I'm Sonali Tayade, Assistant Professor of Zoology. Today I am going to discuss about genetic screening, which is also called as genetic testing. Genetic testing is used to identify the individual who are at risk for genetic disease or for transmitting a gene for a genetic disease. Genetic testing is defined as examining a sample of blood or other body fluid or tissue for a biochemical, chromosomal, or genetic markers that indicate the presence or absence of genetic diseases. It is also called as DNA testing, and it is the analysis of chromosomes, proteins, and certain metabolites in order to detect the heritable disease related genotype, mutation, or karyotype for a clinical purpose. Done. Now, this genetic screening is help us to reveal whether a person carries gene mutation associated with a certain inherited disease. It also rules out a suspected genetic condition. It helps to determine a person's chance of developing or passing on genetic disorder. Genetic diseases cannot be cured and they are often fatal or severely debilitating, but they can be prevented by using the genetic screening test. Now, this genetic test is performed on blood samples, skin, amniotic fluid, hair sample, or any other tissue of our body, and it detects is there any mutations are present in any gene. Now, there are three types of test. One is prenatal, means before birth, then predictive and carrier test. Let's discuss about the prenatal test. This prenatal test is performed during the pregnancy, and this test is help to assess the health of status of a fetus. Now, prenatal diagnostic tests are offered when there is any increased risk of having a child with genetic conditions, and this is due to the age of mother, any family history, if this family having any genetic disorders, or any problem in the fetal ultrasound examination, ethnicity, and suggestive multiple marker skin. So these are the reason due to this prenatal diagnostic test are offered. Now, there are two types of prenatal diagnostic test. One is routine and another one is a specialized. Routine prenatal diagnostic test involves the amniocentesis and chorionic villus sampling, while specialized type of prenatal diagnostic test are placental biopsy, peri-umbilical blood sampling, fetoscopy with the fetal skin biopsy. Prenatal screening is also of two types, invasive or non-invasive. Invasive involves this amniocentesis, chorionic villus biopsy, and fetal blood sampling from maternal blood, while non-invasive involves the ultrasonogram and maternal serum markers. Before performing the prenatal testing, certain precautions must be. Number one is a laboratory that performs the disease-specific test of interest must be identified before any prenatal diagnostic test procedure is offered. The consent of family is required because all prenatal diagnostic test procedures have an associated risk to the fetus and the pregnancy. Therefore, informed consent is required. Use of molecular genetic testing before the prenatal testing is important. In most cases, before prenatal diagnosis, using molecular genetic testing can be offered. Specific gene mutation must be identified in an affected relative or carrier parent. And last, the genetic counseling before any prenatal testing is required. Thank you.